Hello, my name's Adrian Richards. I'm a plastic and cosmetic surgeon and I'm the surgical director of Aurora Clinics. And today I'm going to be talking a little bit about how the face ages. So we all know when you see a face, we know roughly what age it is, you know, plus or minus 4 or 5 years normally. And I find that women are actually normally much better at aging faces than men. So, you know, if you have lived an unhealthy lifestyle and you sort of smoke and haven't eaten vegetables and enough fluid, you know, you might look slightly older than your chronological age, and if you've looked after yourself, you may look slightly better. But essentially, facial aging does occur to everyone. Okay, so what are the 4 main areas of facial aging? Well, important things to think about, and you are doing this when you look at a face, you know, without knowing it, you are looking at these 4 issues. The first one is gravitational changes, okay, and this is basically because we walk upright, the faces, soft tissues of the face are subject to gravity, so you will get descent of the facial tissue, which is characterised by elongation of the lower eyelids. So in youth, the lower eyelid looks very short with a nice smooth curve up to the eyelid, but as we age, the cheek tissue goes down slightly and the lower eyelids look longer. They aren't actually longer, but because the cheek's gone down slightly, they look longer. We also get slight jowl formation in this area, and also as the cheek goes down, we get the formation of nasolabial lines, which comes down from the corner of the nose to the corner of the mouth. We also get gravitational changes to the neck when the skin becomes looser. So normally gravitational changes are best treated with surgery. So surgery tightens up the skin, so loose skin, gravitational changes, best treated with surgery. The other 3 main topics, which often we don't concentrate on enough, are the condition of the skin, the active lines in the face, and volume loss. Okay, so volume loss is very important and often underestimated, because as we get older we lose volume from the face, so we lose the padding underneath the skin. Okay, so youthful faces, children's faces, faces in their 20s have a very smooth, they're very full, very smooth sort of curves, not a lot of shadowing. As we get older we lose volume from around the eyes and particularly around the mouth. So you know, we lose volume from there, and it gives a very characteristic appearance. So the way this is treated is normally by volume restoration, okay, which can either be done via moving the tissues, adding other tissues such as fat, or by treatments which we're going to talk about in other videos, such as Sculptra or dermal fillers. And these rejuvenate the face by basically plumping it up and restoring volume. The other areas which are aging to the face are active lines, and these are caused by muscle activity. So they typically occur between the eyebrows, in the forehead and the crow's feet area. And the muscles basically cause the skin to fold. So children can frown, but because they haven't been frowning for very long and the skin's very plastic, when they don't frown, they won't have any residual lines. Okay, so but as we get older, it's a bit like folding a piece of paper repeatedly. The lines eventually get sort of set in the skin, and as I said, they typically curl, frown, across the forehead, and in the crow's feet area. And these lines are best treated with Botox therapy, because surgery won't affect facial movement. Those active lines will still be there, and filler treatments can help disguise the lines slightly, but you'll still be able to frown. So if the lines are caused by muscle activity, they need to be treated by selectively reducing that hyperkinetic or over muscle activity. And the 4th aspect of facial aging, which is very important and again overlooked, is quality of the skin. So we know when I do courses, you know, I show people pictures of the skin, and you can very accurately assess, you someone's age really from the quality of the skin. So we'll talk about this in other videos, but the important take-home things to sort of take home from this video are that you need to protect your skin from sun, ultraviolet radiation. Even in England, where it doesn't seem very sunny, you need to protect your skin because you're still getting ultraviolet skin damage, and use a very good, probably best medical skin treatments under medical supervision. So just to summarise, the 4 areas of facial ageing which are important are gravitational changes, active lines caused by muscle activity, which are best treated with muscle relaxing injections. The gravitational changes are best treated with surgery. Skin, we need to be prophylactic with that, so we need to look after our skin, and if there is some damage, treat it. And the final aspect is volume loss, which we need to treat with volume restoration. So I hope that's been helpful. We discuss each of these issues in separate videos which might be useful to have a look at. Thank you very much for watching the video. If you'd like any more information about any aspect of facial ageing or any other aspect of cosmetic surgery, please contact us either via the Aurora-Clinic website, or alternatively ring us in the office on 01844 214 362. Thank you very much.